with you. Hello, this is Dr.
Hi.
Masha, a naturopathic doctor. Hello. Hello. Well, today is an exciting day. I'm starting my podcast, and this year I would like to do a series of them where I talk to different professionals in the field of healing arts. And today, my guest is Dr. Valerie Vaugn. She's a naturopathic doctor, and she also holds a degree in a master's in Oriental Classical Chinese medicine. We've been friends for the past more than 10 years. We haven't seen each other in person for a while, been in different places. So yes, today we're going to talk about in a very exciting, important, crucial subject, such as a childhood upbringing, traumas, how we talk to children, right? How we treat them. And yes, I would like to start by asking Valerie to share a little bit about herself and her practice, and then we delve into our topic. Please, Valerie, have the floor.
Well, thank you, Dr. Masha, for that introduction. And yeah, so I have quite an interesting background leading up to meeting you in medical school, in naturopathic school in Oregon. But yeah, I had come from California. I was born in Los Angeles, and my family moved to a rural part, a little bit north of there, between Los Angeles and San Francisco. And I had a kind of a naturopathic childhood because we grew a lot of our foods, and we were outside. We spent a lot of time outside in nature. So, yeah, I had gone through some interesting things and decided I wanted to study medicine. And then my mother went through some very difficult health challenges, and it sort of redirected me. And my steps changed. My path kind of took a side path, so to speak. And so I can so it wasn't it was quite interesting journey, but I ended up working with people who had similar diagnoses and similar treatments to what my mother went through, and I was doing that in a large hospital I was there for about 7 years. And so I started asking questions, and that led me into wanting to do root cause medicine versus and root cause medicine is really about how do we get to the place where we are, and what are our lifestyle choices that impact our health. So, and that all began because I wanted to know why people were getting cancer, and seeing that all ages, even babies, were having, very poor health and even cancer. And I wanted to understand the process. I really wanted to understand it as it develops, like how does it happen? And so that led me to going back to school and starting school in Oregon. So that was a whole new experience, new state. Everything was different. And I decided to actually study the classical Chinese medicine also, just to get a very much more, I was always kind of wanting to understand the whole picture. So very holistic. How was our environment, nature, the macrocosm, we call it in that study of medicine, is the macrocosm, like how are we a part of that, and how can we understand ourselves better by understanding that macrocosm. So we're the microcosm in the macrocosm, and how we can understand how things work like that as a whole. So that really was a good experience in 7 years of studying. And then I ended up coming back to California and being back in the Bay Area, which is where I had been working prior to going to Oregon. So I was back in kind of my old stomping grounds. And I started my practice in a place called Los Gatos. It's about an hour south of San Francisco. And I ended up holding this private practice as I was also working with other doctors and other practices. So I ended up going down to Southern California. I was in San Bernardino County working with chronic pain patients. And that was quite an experience, and very, very interesting experience there. And then I returned to the Bay Area. And I think that the past 5 years have just really sort of helped me to shape. So I was 7 years in practice, in California. Again, every 7 years, big life changes. So over the past 5 years, just seeing what was happening with the health field and the medical field, and I had to kind of shift and figure out how to do things and still stay truthful and aligned to the wisdom and understanding that I had gained all the previous years, and at the same time too, realizing that I needed to change my life and my lifestyle, and my health needed help. And so it led me to realize that another calling I have is to write. So I took a writing sabbatical and started traveling. And I started working 100% online. I was doing some of that, and it was working and going well. And so I decided to just do 100% remote travel and start writing a book, kind of pulling everything together. And also, I was told by an incredible healer that it was part of my healing journey and part of healing my whole part of my soul purpose was to communicate through writing, and through that I started this travel, which I'm currently now in Greece, and so that's I'll leave it at that for now.
Wonderful. Thank you so much for sharing with us. I loved how you said the root cause medicine. I wrote it down even because it just points it exactly where we are and what we're trying to do as naturopaths. So are the practitioners. So we can talk a little bit about this fascinating subject, right? Because we all were children at some point, right? To come into this world, first we go through the childhood, and it is the most crucial time period. And so I feel like that these days, especially, we are longing for this knowledge to get deeper into understanding children more. The psychology, we even get into the past lives, we get into numerology, astrology, trying to understand how can we help them grow, and how can we make their experience in this realm, in this world, less of a trauma based, right, in childhood. So what is your take on this? What do you think we should do in childhood to prevent this trauma-based life?
Well, I think it's interesting when you say trauma-based life. I haven't heard that before. Maybe I should write that down. But you're absolutely right. I think I'll answer that question, but I want to back up and say, since we're talking about the beginning, that actually the beginning of life for us in the physical body, it actually precedes the birth, right? Because there's a conception time, and then there's a time in utero, and actually that time in utero, and even the conception, actually, the dynamic between the parents impacts the being, the new being, whether what the emotions were, what the dynamic between the two, not to mention all that they carry in their mind and bodies, that impacts. And then there's the 9-month in utero period for most. Some are born earlier than others, but it's typically about 9 months, and that's a crucial period too. So and then after the birth, the first 6 to 7 years, the brain is actually in theta, which is similar to hypnosis. And what that means is that the mind is not analyzing good, bad, right, wrong. There's no judgment. It's just absorbing information. And that's crucial to understand, because when you say trauma-based life, I think that most are living unconsciously from that programming that happened in those first years, right? And until you become conscious that there's programming, and you can sort of undo what the mind is doing, and there's different practices that can help bring that consciousness and that awareness so that you can make conscious decisions. So instead of reacting, I think you use that word reactive, the reacting from a program. And then when it comes to trauma, traumas are not necessarily, I would say that it's how the person is processing information determines trauma, whether it's capital T, big trauma, because they have classified this, or small, a lowercase t. But really, it's the person's response, the reaction to what's happening, and not so much the event, because what's traumatic for one may not be traumatic for the other, or might be a big T for one and a little t for another. It's the way that it's impacting the child or the person that determines, and what that impact is. This is what makes it trauma, is the disconnect from the self. It's the abandonment of the truth, or the true self, or it's the relationship with the self that is altered. So one of the interesting things is this concept of reparenting is one. Although traumas can happen, it doesn't have to be between parents and children. But I think that you were wanting to focus on that particular relationship and dynamic. But since you wanted to focus on that, I could say that this idea of reparenting this inner child is how you can unravel this trauma-based life. That I think that's what you were meaning that you're reacting from your trauma and from wounds, like there's triggering that reminds or hurts in similar ways, or kind of touches on those unhealed traumas or wounds that have been inflicted. And so how do we become aware? We must understand that we need some time when we feel this triggering, that this emotional, visceral sometimes, we want to react very strongly to something, to make some space and kind of do some questions. I think Gabor Mate, you're familiar with him. He has a process called compassionate inquiry. So there's different ways where you can sort of create some space and kind of see where things are coming from. And when you do that, then you can sort of reparent yourself and giving yourself what you need that you didn't get, or kind of being with yourself. So it's like a reparenting. And, we typically, I mean, ideally, we have more than one parent. So it's understanding sort of what those needs are, and how to, and how to cultivate this healing process. So I think as a whole, when you talk about things going on in the world collectively as a whole, we're recognizing we really need more nurturing, more mothering, more holding, more containment, and that's more the feminine, is the support, the listening, the gentleness, that sort of thing. And then the masculine, parenting is more of the sort of, keep protection, making you feel safe, and also the discipline, understanding those qualities of parenting. So we do that for ourselves. We can do that for ourselves, and then and become more whole. And we can also heal our lives, because now we're having more healthy relationships with others, and we're not attracting similar dynamics, because we will do that. We will put ourselves and find ourselves in interactions with others that will trigger these things. It's just amazing, right? And we can kind of one by one take each situation and like, you know, get a chance, an opportunity to tend to these wounds, and that's how we can heal it and become more of a person who understands. One thing I would say too, I want to also put in there is that education for many of the healing professionals, even helping professionals, you know, in teachers and ministry in churches and things like this, and certainly in the healthcare field, you know, you have people that are really wanting to help others, but they really aren't trauma informed, and maybe they haven't even really healed their own trauma, and so they can become triggered and not really understand how to take care of themselves, and also to how are they meeting others in their wounding and their triggering, and understanding that. I don't think that we really get enough preparation. I think they may mention it here and there, but it's something you really end up finding out as it happens. And
Absolutely. I think you brought up such good points, right? There has to be more information for you as a person going into healing arts, helping arts, right? Nurse, doctor, teacher, service, right? Where you provide a service, you interact with people, and especially you try to resolve something for them, even if you use a medication, right? They show you more of their understanding. Where does the chronic pain come from that the patient come to you, right? And when you chat with them, you understand that it may be nothing to do with them needing to fix that pain, but needing to fix a lot deeper layers, right? It would be sometimes we just kind of imagine the world of healing arts where it's actually true healing. You go to the doctor and they ask you about your childhood, right? They ask you even about anything in the past life, right? They ask you and it becomes the norm, right? And then it's really healing and we're not wasting time, right? Like 20, 30 years taking all these medications and you realize, oh my gosh, I should have been healing what happened in the past and delving into that, right? So more education for the professionals. And also, I feel like as a parent, right, you start learning with children and you're realizing that it's more learning about yourself than about so much about how to bring them up and about them, but more about yourself, that what triggers you, how you react. Would be good also ideally to have some kind of preparation, right? Preparing yourself for this journey, even if you're younger in your 20s, right? That you just coming across more and more in the books and classes, right? Even in high school, it would be good to have classes like this where you're learning and then you bring up somebody whose life is more fulfilled and beautiful and you participate in it in your life, right? So yeah, we definitely need to talk and educate more about it since we're starting to understand or wanting to understand more. Beautiful. What do you think about this, the criticism, right? The criticism that happens in childhood is so easy to do, right? And sometimes we don't even observe how we are so critical, right? And criticism can come in all kind of different ways. What happens to the child when we criticize them? Because you're saying they are in this theta wave, right? For a while, kind of like a hypnosis. It's a beautiful, slow, right? Wave. Sometimes when I'm playing with my kids, I kind of switch. I want to switch to their wavelength, right? It's like on their wavelength, and it helps me not to be too rushed or too harsh or willing to do this, right? I just let's go with the flow, right? So what do you think about that criticism? What does it do to us?
Well, again, I think I can generalize, but I would say that, everyone's unique, and that's one of the things about the medicine that we offer, that we learn, is that each individual is unique. So I was one of five. My father actually had six, but I grew up with four siblings, and we're very different. So, what one might consider a criticism may not have felt like that to another. So I wanted to state that first. But
Very
yeah,
good. Very
it's
good. Yeah,
interesting.
thank you.
Yeah, but it's interesting though, because I would definitely say that my father was very critical of all of us, and I can speak to that being a trauma for me for sure, with being kind of this response of like afraid to make a mistake, like trying to be perfect, or becoming sort of frozen, like not really knowing what to do, because I didn't, this idea of sort of being focused outside more than on the inside. This is something we discuss in medical school with homeopathy, with that education, is this internal locus versus the external locus of control. And so when you have a threat outside, obviously you're in fight or flight, there's a lot of stress around that. And so the focus becomes less internal, listening to your heart, to your soul, to your truth self, and you're sort of in the survival mode, right? And that can kind of get set over time, because think about, if it's a parent, it's a daily thing. And one of the teachers in the classical Chinese medicine program who was teaching Chinese psychology said, when there's a mental illness in a parent, it's like trauma every day. And so that's kind of what happens is, you become stressed to the point, your body's reacting with all of this cortisol and adrenaline, like your life is at risk. And so you're running on fight or flight, or we know there's now fawn or freeze. There's other things. We're not necessarily running away. Some children do, because they feel very compelled to, they make that decision, that then they run away. That happens. And for me, it was more of like a frozen, like I kind of stepped back. It's interesting what you said about participating in your own life. I felt like I was so afraid of this critical, this criticism. I felt so nervous about making a mistake that I was kind of became this like observer, instead of somebody who was like you said, sort of like participating in my own life, like figuring out what I want to do and who am I,
Right.
and what, yeah, going for it and falling however many times. Failing is not fatal, right? You can get back up, and being able to make mistakes and be able to breathe, be who you are, express yourself. Like I became very silent, which is also what my mother's response to I think it's just kind of the authoritative, the very patriarchal, very critical, very, is that you suppress. And I think that really led into her illness, was suppression of her immune system, so that she became so suppressed that even her own immune system wasn't functioning to keep her well physically. So yeah, criticism. Also, I think what happens when you talk about those early years, when the brain's in theta or hypnosis, it's sort of like that voice becomes internalized. So even after you're out of the situation, right? Like let's say you've grown up and you've sort of moved on in your life, but now you hear that voice, right? And it can be difficult to distinguish where it's coming from and what to do about that, because you can sort of, you're now out of the situation, but you're still running on that stress and that fight or flight and that like survival mechanism of perfectionism, because it could cost you something. It could be fatal. You think it's fatal. It could cost you your life, but it really.
Right.
So that would be, I think, my experience. But I think that, if I look at it through my siblings' eyes, maybe that propelled my older sister is quite successful, as my older brother. He didn't grow up with us. He's quite a bit older, but I would say that my siblings are quite successful in their endeavors, and accomplished. We've all done quite a few things. So I think it can also be motivating,
Right, right.
it can be motivating, right? That this desire to please. So that's the other one, the fawning. Like, okay, so this very hypercritical voice and presence can actually make you kind of, it can be, I don't want to upset this person. I want this person to accept me. I want to be loved. And you become, again, it's an outward locus of control, but you can try to please, the people pleasing, right? I
Right.
gotta,
Right.
and it was a big deal to get straight A's and to do well in school. And I mean, that was something I did. I did that very much throughout my life, and even going back to school and doing more education than most, right? Because I heard that, I believed that. That pressure was important for me if I was going to survive.
Right,
I believe, yeah, I believed it, right? Like, there's other people in the world. Not everybody goes through all the schooling or any schooling. So it doesn't necessarily. It's not. There's no one way. And I think with the criticalness, you can feel like you don't have options. That there is only one way, and you have to kind of make it happen, or else there's kind of this consequence that seems very overwhelming, that with a critical person. I would say too, another thing I heard somebody else share this actually once, and I can definitely say that this impacted me also, is that if hearing critical things about others also from a young age, and it kind of trained my brain to be critical myself, not just of myself but of others. So I would say, yeah, those critical years, it kind of shapes how you see things and how you are processing. I think it happens, especially during those formative first 6-7 years after the birth, a physical birth. Even in utero, though, you can hear the voices, and even you feel the emotions, right, of the mother, and the voices of the mother and others around her. And I think that I think we're going to find out more and more. I think we're going to keep learning about how these impact, a developing child. So I would say too that you realize, at least I have realized, I adopted, or I was programmed to sort of think in a similar way, to see things in this way, and I want to. I would say it's possible to undo. I think it's possible to undo this. I think so.
Right,
And
right. Just like how you were saying,
yeah.
that we can kind of set our mind, observe and thinking about it, analyzing and, seeing our triggers. A lot of things are based on our own fears, right? So we have fears as a mankind. We're known to have fears, right? Sometimes they say that it's a very human thing to be fearful, and it could be fear for different people. It's different things, right? Some fearful of something bad happening, right? And they're just so focused on that they maybe the criticism or constant overshadowing, overprotective comes from that, right? For other people, they don't even care about that, right? They're lax about that, but then It could be some other things, right? So it's all fear, and working with your own fears as a parent. I found for myself at least, right? Recognizing where's it coming from, my reaction. Oh, maybe from this. So maybe looking more into it, that I, shouldn't go to that place, right? It should be approached more with love and care, and less with criticism. I wanted to share this interesting story. I usually don't consider myself critical, right? So, we all want to think of ourselves, well, I don't do it. But there was a situation a few weeks ago with my 7-year-old daughter that, everybody comes with their own personality into this world, right? And so we have to live with each other. And so, she doesn't really listen, she doesn't hear me sometimes, and which is her right too, right? But then when I tell her, she may do otherwise, right? And then you may be fatigued by the end of the day, you've just been running around. So I've been kind of, one day on Thursday, we had some company, and she did something, and I brought her into the room to say, well, all right, you did this and this. I was calm, right? I was just still saying things. And then the next day, I said something, this and this and this, and even made her cry a little bit. She would say, Mom, I don't want to hear it. And it's still, because I have to say it, right? I have to tell her. And then the following day, and it's interesting, for the past 3 of these days, she had a dream of a snake. She was still waking up from that there was a snake, and she was sharing with me, and I was saying, I started analyzing it, and I said, you know what, that snake was me. It was me trying to be critical, very critical, right? In a way, though, to me it didn't seem like it, but some things could let go, or I can say it in a different way, especially by the end of the day, when we as parents get running around the whole day, and you want them to go to bed, or you want them to do certain things. And then I analyzed my behavior, how I could be, and of course children analyzing too, in their own way. So yeah, after I kind of analyzed it, and we replayed this, and the dream disappeared. There was she didn't have the recurrent dream, but it was interesting that they kept going this dream of a snake. Of course, you can say, yeah, it might be something else. There are other things going on in children's lives. Maybe they watch something, right? Maybe an exposure, possibly, yes. I mean, you cannot always say with 100% assurance, but from what I understood, that it was probably the critical, the fear-based. Sometimes some of them are triggers that I need to work on. So parenting is really a constant work on yourself, right? Constant work on yourself. So recognize that the children already come with their own personality, with their own baggage of past lives, with their own things that they need to work on in this life, right? So they're not going to necessarily obey. They're not supposed to always obey everything, and that you need to help them, right? Recognize it. Recognize the shenanigans that they come come with, right? And then you help them work through it, and you're working through yours, and together you're showing them and that showing them the process, right? The process, how you can work through it by talking to each other, by addressing things calmly, by not reacting right away, right? Maybe just trying to calm down, breathe, and they say things less, more kindness, right? More loving. So it's good that they watch us work on that. Maybe that also makes them think and ponder even later in life, right? To work on those too.
Right. Yeah, I think what you're saying is all very wise, and you learn it as you go. And it's really about meeting people where they're at. I remember I haven't birthed babies, but I've spent a lot of time around children. And prior to starting the naturopathic schooling, I took care of my older sister's children. I helped take care of them for about 6 months. And what you're talking about reminds me of an interaction with one of the children. She had two boys, two sons, and the younger one, I believe it was his birthday, it was during the summer, and the children were, they're very much outdoor and active, and he had a birthday and a party at like a fire department. It was a special fire birthday party. And I wanted them to get in the shower and get clean for the party. And yeah, for some reason he was afraid. I don't remember all the details about it. And I remember being concerned about getting him into the shower, cleaned, and to the party on time. And later I became very, I could say convicted, or very like, wow, I didn't attend to the fact that he was afraid, and being with him in that fear, and like helping him realize he was safe, and kind of helping him work through it. I was just trying to get, so my actual, who I consider my daughter, is a furry four-legged dog. And it's similar, when we talk about fear, I think we have this reptilian part of our brain, and I think there's something called the amygdala, right? Part of those parts of the brain where we have emotions, and fear is an emotion, right? It's part of life, and sometimes it's helpful. It keeps us alive, right? There's good reason to be fearful at times. It can save our lives. And there's other times we can feel afraid and we're really not at risk. We're not really, there's no real threat. But many times we're afraid of the unknown. But my dog, she goes through, there's times she's changed, even on this trip. She, in the United States, she wasn't afraid of fireworks, or I remember her being quite cool as a cucumber during the fireworks and 4th of July. And then on this trip, she's become so sensitive to those kinds of sounds, those loud blasts, fireworks or gunshots. We spent a lot of time hiking in mountains, and so we were kind of out, and we've been in, cities quite a bit too. And sometimes there's parties and fireworks and things, and she's become quite afraid. And, it's recognizing, okay, this is a change, and what does this mean? My dog's still, she's 9.5, but she's like a horse. She's powerful. And when she's afraid, it's very difficult to, navigate, especially if I have other things in my hands, or, so she can pull. So, it's recognizing where a being is, and understanding what they need and supporting that need. And I think, again, going back to the collective, I think we're recognizing we need the feminine. The healing really comes through that feminine nurturing, the presence, the support, the acceptance, the love. It's the mothering, right? We need that too sometimes, and sometimes we're not going to necessarily get that ourselves, so we can do that for ourselves, so that we can offer that then when the time arises, whether it be any situation where we can be with another who needs that kind of support. So you can recognize it once you realize that what's needed. And I'm really grateful for those experiences where I think they slow us down, and we realize that we're maybe running on fight or flight as though things are an emergency when they're not. And we can start attending to the present moment and being with ourselves and others, and with whatever's coming up, without this need to control. Right? That's more of the
Right, control. Right. They need to
control. That's where we go. That's where fear leads us, right? We feel afraid of something, so even with my dog barking, has been barking more sometimes. She was barking right before we started talking here, and I observe her. First of all, I'm like, what are you seeing? What are you smelling? What are you reacting to? Versus, just stop, right? Even though sometimes she does need to stop, like, otherwise we wouldn't be able to have the conversation. She's got a loud bark, but it's also really nice to be like, what's happening for this? What's happening here? Being curious, right? Asking questions versus the need to kind of control the situation or
Mhm.
control the behavior or and I think that that's the key, is to realize that the curiosity, the inquisitiveness is also very necessary um, in order to sort of get um, to a place where you can hold the space in a healthy and a even healing way for whatever is going on. You kind of have
Right,
to take a deep breath and like, okay, let's be with this. Let's be here now, as Eckhart Tolle
right,
says.
right.
Let's be here now and let's attend to what's happening here. We don't need to necessarily control it.
Right, right,
Um,
right. Yeah, letting go, right? Letting go, but letting go so that it wouldn't come back. I was recently fond of listening to Alan Watts, the philosopher. So he talks a lot about the Eastern philosophy, uh, Buddhism, Taoism, but he talks about the how we let go, just let go. And I started practicing it, right? I was like, yeah, I'm just gonna let go of this situation, or let go of my anger, let go of my reaction. And I was doing pretty well. But then I noticed one trend that, yeah, I'm letting go in that particular instance, but then it's still inside of me and it comes out when I am aggravated or maybe upset. It comes out, right? And I was thinking, so was the point of me letting go if I'm just putting it back and then reminding everybody that, hey, this situation happened and I wasn't happy, and then la 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 la. So yes, and I realized that letting go means you let go forever, right? You don't come back to it later. That letting go just means storing things for later, right?
mhm,
You
mhm,
really you just forgive, right? Forgiveness is a big one with relationships with yourself, right? Forgiving yourself at that moment. Yeah, and that's an interesting thing I wanted to say, that as a parent we always feel rethinking things, ruminating of things, so we start feeling guilty, right? The guilt or
mhm,
something.
mhm,
And then I heard that the best thing we can do is to practice forgiveness right away, right away. Not only to those around us, without any doubt, but to ourselves. Forgiving myself at that moment, right? So I had this reaction. Yeah, that's all right. I forgive myself of this. And then repair, right? And then you may explain to others the reason why you said those things were like this, and you apologize, or you forgive, or just again, just talking about it, discussing your emotions, right? But yeah, I really realized this lesson recently, that the letting go means to completely get rid of it out of your system and not even
mhm,
remember it a month later. Uh, so.
mhm.
So yeah, it's a lot of learning on our part, right?
I think that's an interesting concept of forgiveness, and I've been contemplating it and for a while. I've first of all say that it's definitely a challenge for
Yes,
me.
yes, yes.
Definitely been
It's
one of
a challenge
those.
in general.
Yeah, that's easier said than done. But then recognizing in our lives, as long as we're here, we're going to be losing things. And even when we sleep, it's a time where we kind of let go. And when we go and we go to the restroom, we're letting things go, so that we've got to keep a flow. And also with emotions, recognizing, okay, I'm here, I might be angry, I might feel hurt, I could be sad, there could be grief. And it's not permanent, right? This too shall pass. So it's
Right,
more
right.
about being with whatever's happening, doing that internal inquiry about what being with yourself versus, so that's the internal locus, right? The focus is on the internal versus the external reacting to things, right? So the
Mhm.
introspection, the reflection, the prayer, the meditation, these things kind of bring us back to home or in ourselves. And then we realize that over time, I realized like, oh, the external world is really a mirror showing me what needs attention inside. And then I'm grateful. I'm like, what's there to forgive? In
You're
fact,
right.
I recently posted something about this. It's kind of a joke meme with Matt Damon, and he's like, before his graduating class, he's graduating, he's saying, thank you for all the triggering, because it's helped me to face and heal the dark side, the shadow, the things that are hidden, the things that most people are hiding. They don't want to even see or feel themselves. And we run away from it, and we focus many times on the external world, and we don't want to deal with what's going on inside or really feeling that pain. But that's really how the cycles are broken, is somebody who's willing to feel the pain, someone who's really willing to hold the space for the healing. And then it impacts, your whole system, the family system, everybody around, like, that you're connected to. And that's really the beauty of it, because you realize, wow, that's impressive, that's powerful, that's really important. I want to be that one, and I
Right.
guess I made that decision to be that one because somehow I was that one, And going back to the recurring dream, I had this happen as a child for many years, having a dream many, many times. And no matter how many times I had the dream, it was still quite real, and it played out the same way. So it's not like I learned from having the dream a few times and then thought, okay, I don't have to get as upset about this dream. But yeah, I was losing my teeth in the dream, and it was very upsetting. And then I'd wake up and I'd see, oh, I got all my teeth, and I'd be, oh, relief, wow, you
Right.
know. And, I went off to university. I was about 17 years old, and I joined dream groups. That's how significant that dream was. I wanted to understand. But the understanding really didn't come until I was in Oregon at the naturopathic, and I was studying the naturopathic and the classical Chinese medicine. And sometimes the classes would be at the same time. So, for example, the naturopathic cancer class was on the same day and time as the Chinese psychology class. So this is a true example, real story. And so it turned out that the classical Chinese medicine and psychology teacher, professor, just told me, here's the book, you can read it on your own time. So I said, okay. So I took the book and I read it during the summertime. And as I was reading through the book, I came to a chapter that described the dream. And not only the dream, but what the dream was about. Like what it was symbolic, what the meaning of the dream was. And it nailed it for me. And because of the dream being interpreted so precisely for me, I was able to realize that that whole chapter was describing the healing process that I needed on every level, every level. And I really, I knew it without a doubt. So I went to the clinic at the school, and I said to the teacher, he was also a clinician, so he's doing acupuncture, and he was very brilliant and effective. And I said, hey, I diagnosed myself. This is the diagnosis. So he asked me some questions. He confirmed that it was accurate, and he treated me, and he said some very wise, significant things I've never forgotten about how to heal. And, I think that the body, it's interesting because the body doesn't lie. They say with trauma that the body holds a score, right? So it doesn't, it's accurate. It's going to tell you the truth.
Right.
So when you're healing, your body is going to be well, you're going to have health. And if you're not, then the body's going to let you know too. So, so I think that, healing doesn't just happen in one treatment or in one moment. It happens over time. And I think that's something that I realized from that experience was that, wow, I had a diagnosis that, it was going to need time to do it. So basically this dream and it was correlating with a wood yin deficiency, which is the liver yin or liver blood. It's yin, right? The feminine, the liver, which is our one of our wood organs, and in the allopathic Western English, we would say it's anemia, not enough blood, right? So yeah, so that that progressed, and now finally, I'm really understanding it on so many levels. But this is the end level, right? It's the physical, it's manifesting. So it's interesting what you said about chronic illness or symptoms, pain, for example, and how the body is going to let you know if something needs attention, and if you can suppress it even with herbs or even natural therapies. You can silence it, you can relieve it, but it's not going to go away on its own. It's going to be there because you're not addressing where it's coming from. And oftentimes, if not every time, there is a mental, emotional, spiritual cause. It's energetic. There's something in the invisible world, the intangible world, that is needing our attention. And there it is again, coming back to what needs attention, being with it, listening, asking questions, holding the space, supporting what needs support. So that's very different than this like fighting against these symptoms, trying to suppress them, silence them, fighting cancer, fighting COVID, fighting this, fighting. It just doesn't work. Eventually the consequences, the outcome isn't really healing. It's not going to bring us to what most of us want, which is like what you said. We want an authentic life. We want a full life. We want a healthy life, a vibrant life, a life that's aligned and true with our soul and our purpose for being here. And so there we go. So talking about recurring dreams, that everything's speaking to us, the body's letting us know.
Right.
We're sleeping, having dreams. There's people around us. There's children. There's dogs. There's everything out there trying to get us to pay attention to something.
Pay attention to something, right?
There's something there for us. And it's not, we don't always know what it is, but I think the curiosity, at least being willing to look, is important, I think, versus, that's uncomfortable, or no, can't go there, or I'm, gotta be here, gotta show up, all of this kind of external, again, motivating us. A lot of it's fear, of the consequence of not performing or appearing or being a certain way, that we can, going back to the trauma, we can feel we have to be a certain way, and it may not be really who we are, or what we really. So
right, absolutely. Such beautiful words, Dr. Vaughn, such beautiful words. I love it what you're saying. Yes, we live right now in a very amazing time. We have the access to the information, to talking to each other, to sharing, to going into so many subjects and researching them in depth, right? So that we can get to, like you said, we're going to understand it more. We are going to understand it more. Yeah, we are, and that's beautiful that we are willing to do this. So yeah, I'm glad our souls chose this particular time period to come into this world and discover more this about ourselves and others. Well, if you have any last words to say, any recommendations for our patients out there, for people, for children, feel free.
I recently, it's interesting you asked, because I recently posted, I think the day after Thanksgiving, because I actually stopped really participating in celebratory ways with the Thanksgiving, because it felt important for me to, I'd heard a speaker in San Francisco. He was teaching at a school. He's wrote a book called Healing the Soul Wound, and he was really kind of he's part Native American, and he also grew up with a Christian upbringing, so he has a unique. His name is. Give me a moment. Wow, I got to remember his name. Sometimes that happens. Eduardo Duran is his name. He
Uh-huh.
wrote Eduardo Duran. He wrote Healing the Soul Wound. So yeah, I would say that when we start this process of healing ourselves, we start recognizing what around us needs healing, and we want to be a part. I want to be a part of that. I want to help bring healing. So it was very also, it's when you give, you receive more than you give oftentimes. So
Mm-hmm.
I yeah, I started participating before I took this trip in the Native American celebration on the actual Thanksgiving Day, which was taking place near San Francisco on an island. And, it was all about Native culture, music, and preserving their culture. And it was very healing for me. And I don't have genetic, genetically, I'm not Native American, but it didn't matter. It was like, and I think that that's always been something about my heart, was that I could feel and see myself in others. And it didn't have to be I don't have to be racially or genetically or culturally the same. It doesn't matter. We're souls here. And so, yeah, so I found also by it, participating in the healing of others has healed me. So it's very interesting. But one thing I'd say, so that now that I'm out of the United States, or after Thanksgiving, on Thanksgiving, I tend to be with whatever comes up. And sometimes it's, I can feel a lot of discomfort around Thanksgiving and what it's really about, which many Americans don't necessarily have conscious awareness of. And really holding that those feelings and being with those feelings. And so the day after Thanksgiving, I could breathe. I could feel something shifted. I can breathe again. That's one of the signs for me is able to breathe easier, deeper, and experience more joy and lightness. And so I decided I was going to post, instead of many practitioners are selling supplements and selling things with this Black Friday. I decided to share a list of books, and there was actually an interview similar to what we're doing with a doctor talking about how childhood trauma manifests later on in life is in chronic disease. And so I wanted to give resources for people who felt compelled or open and willing to start walking this path of healing themselves and to heal their traumas and to help even others, wherever the person's at. If they want more information, I wanted to be able to share these things with people so that they could start somewhere. And once you start, it's like you're on the path. You take one step, you read one thing, you're opening yourself now to that world. So you don't have to figure it all out. You just start with one step, one decision, right? And sometimes there's one book in particular, it's called Healing the Shame That Binds You by Raymond Bradshaw, I think. When I first started reading that book, it was many years ago. I was not even in naturopathic schools. Years before I started reading that book, I always had a lot of books. I don't even know where I get all these books from. And something made me open the book, and I started reading it, and I realized I'm not ready for this. And I closed the book. It's okay. It's like I knew I didn't want to go there. It wasn't permanent. Eventually I came back to the book. I read the whole book. I went through my process that I went through with reading that book. It's a great book. There's another book called, I don't know if it's on that list. Now that makes me want to add it to the list. I got to come back to that. There's a book that I know is not on that list that also, I think I took it, I paced it myself. So that's a nice thing, right, with a book. that's why I want to write a book too. You know, it gives people a chance to kind of take it at their pace. You know, you can go as fast as slow, whatever, you can do what you need to do. But I think reading is a real, I don't know how many people are reading these days or reading books, but you know, they're online many times and even audiobooks or whatever. So I would recommend, I would say for this, I would say if anybody's wanting to learn more, perhaps you can, I share that list with you
Oh, very
and
good.
you,
Yeah, I can put it
yeah.
under that video, right? We can put it under the video, the list of the beautiful healing books that you mentioned.
Another
Uh,
thing I do is I can also add therapies that people, if people want to, are not readers and don't want to read or whatever, if they want to start working perhaps with somebody, the different therapies available that they may be interested in. Because one of the things you mentioned was the past lives, and that can be very foreign for many Westerners for past lives, you know. What the heck is that? And that can sound very metaphysical or very woo woo or very, you know, strange to many people. Um, so what I can say is that there are definitely books about that. One good one is Many Lives, Many Masters by Brian Weiss, who's actually a psychiatrist who learned, he got into it because of a client he was working with, one of his patients.
mhm,
Mhm.
mhm.
So there's books, but let's say you're not a reader, then there's like past life regression therapy. And I experienced that. I'm a reader, so I like the books, but I've also done the therapy. And
Mhm.
it really kind of like confirms for you when you have sometimes when you need somebody along the road sometimes with you. A kind
Right,
of,
right, right.
yeah, because
Yes,
that may be their expertise and they can, it can be helpful. And if you have
right.
the, if you have the resources and the willingness, then that could be a game changer for many people, right?
Oh,
So,
absolutely. I had a post the other day where I was just saying that what if past life regression or past life knowledge would be mainstream therapy, right? That
mhm,
in order to heal something, we would delve into the past lives and there
mhm,
could be different ways. And then it would be how one practitioner put it for me. It's healing coming for the nervous system in our present day that, oh yeah, yeah, it all kind of makes sense. A lot of times people say oh yeah the you know not surprised but then I really feel it that there was something before that I came into this world and the memory got erased, right? But
mhm,
it makes total sense to me and they can work towards healing it or just understanding more about yourself. That's
mhm,
beautiful. Yeah, it's. I think I know that sometimes they're not recommended for children, which I can see why, because it could be traumatizing. Because past lives, right, could be all kind of sorts of ways. There could be
mhm.
strange deaths, right? There could be really torturous events. So yes, for children, they're usually not recommended to go through the past life. Um, but once we're already older, then you know hypnosis and different other ways of getting into it, deep meditation, working with different practitioners. Oh yeah, that would be great. If you want to share the resources, that would be terrific,
Sure.
terrific. Well, it was
Sure.
such an insightful conversation.
I just wanted to add one more therapy there that is sort of Gabor Mate's getting,
Oh
you
yes,
know, Gabor Mate's getting more vocal about it, and it's actually many. I see many people in our profession also is the plant medicines. So we have and Eduardo Duran, the Native American person who wrote the book Healing the Soul Wound. You know, they're using plants and herbs as part of the therapy. So I think we can also take advantage of, you know, we can have therapists or teachers or, you know, we have people along the way, but we also have plants, right? So
right,
uh,
right.
plant, plant, plant medicine is very powerful for
Yeah.
people who really
Ayahuasca,
want to,
right? Ayahuasca could be one of those
yeah,
ceremonies right? And some
Ayahuasca's
other therapies.
yeah, it's
Mhm.
powerful. It's
Right, right, right.
life-changing.
Yeah.
Yeah.
Mhm.
So definitely, I can definitely say that that is a very, but again, I think what you mentioned too is like, you want to make sure mm, you're doing these things in a safe and a healing way, right? Like you want to make sure that you're so I think that's an important thing is, and something we can offer is to give resources and information that we believe and trust so that people aren't, we could talk about Dr. Google on the online
Right,
trying to
right,
find
right.
things
Yes,
and not
absolutely.
necessarily,
It is
mm,
one of the helping ways is to share. Right, to
mhm,
share what we've got, that we've tried it ourselves, to tried it with others, and then why not somebody else can benefit from it, right?
mhm,
So that's
right.
beautiful. Beautiful, beautiful. Well, I'm so glad we had this conversation. I learned a lot.
Mm,
And it was such a great pleasure seeing you, chatting with you, hearing you speak.
mhm.
I wish you all the best in all
Thank you.
your adventures, in all your endeavors. Uh,
Thank you.
just wish you it all will, I know that it will all come true. It will all be beautiful, what you're planning, what you're doing right now. And yeah, we'll
Mhm.
keep in contact, and if anybody wants to contact Dr. Vaughn, I'll give her information down below in the link. And yes, we wish you all a wonderful year.
All best wishes. Thank you so much, Dr. Masha, and
Yes.
really lovely talking with you and seeing you. And congratulations on your family and practice and all the things you're doing and planning for the upcoming new year as well. And for all the listeners, thank you for your time and bless you on your journeys. And reach out to us, Dr. Masha, and or myself, if you ever need some support, have questions, we're here for you. And
Yes.
Happy New Year to everyone.
Yes, happy new year to everyone.